I'm thankful for our governor's swift response to the COVID-19. In March, he had issued an emergency order even before we had our first confirmed case, shut down schools when we had our first confirmed case. And I really think that helps stop, slow down the spread of COVID-19. And ever since then, we're taking the necessary precautions while also trying to open up slowly, because we also know that this is going to have effect on not just our economy, but on our mental health, suicide rates, and those kind of things. And he's been listening to the public health officials and really following science to try to keep Montana healthy. And so I'm very thankful that we live in this state and that we have his leadership and that he's listening to those who know best. And then at our county level, I know you didn't ask this, but just a little plug, I believe our county has also been doing a really good job at keeping people safe. We are going into another wave. It's just, if you look at even the 1918 pandemic, that's how it was. And so it'll be interesting to see what happens in the next few months or weeks, really. So ever since I could vote, I have voted absentee. I've never gone in except one time when I lost my ballot to actually vote without having like a previous ballot that was mailed to me. So I really believe that they're very secure. Montana has been using them for over 30 years. And before this all happened, about 70% of Montanans already mailed their ballot in. So I believe we are very equipped to handle this kind of thing. I do like that it was up to each individual county to do what is right for them, because that is, what needs to be done for the local control. Because, you know your county best, what's going on there. So I do really believe that they are secure, and we have been using them, and they've shown time and time again. Plus, you have not so much wait time. Maybe you can't get off of work, or maybe it's harder for you to get over to the Four Seasons where the election, where you would drop it off. So I believe that they're very secure. I would not, because it's a regressive tax. So those who are lower income would be paying the same rate as those that are higher income, and I don't support that.
Okay.
And Montanans don't want it. That's it's very, we don't want it. So. Well, that's not really up to me as an elected official, because it is a citizens initiative. That's for the voters of Montana to decide. And so if it does get passed, and we'll look at that, I would, if it does get passed, I would respect the voters of Montana, and then whatever we need to fix or add to, I guess, more, not fix, but if whatever we have to add to that initiative, we could do that in the legislature. But I really truly believe, this is a citizens initiative. They went out, they got the signatures, and that is now up to the voters to decide. Overall, the ACA is something I truly support, especially because it has expanded Medicaid in our state. So where now 90,000 people have access to healthcare, and especially with Native Americans. Previously, when they went to IHS, it was like a life or limb situation. Now we can fund preventative measures, and it actually saves us in the long run. Also, pre-existing conditions are something that definitely needs to be protected. All of us, I once heard a quote on one of my favorite podcasts that is, living is a pre-existing condition. So we all usually have pre-existing conditions. And now with COVID, if you have COVID-19, that's going to be a pre-existing condition. I think the one thing that we still do need to focus on is preventative medicine. I know it's part of it, but we still don't really, since I work in prevention, I'm always thinking of preventative medicine. But I think just as a whole country, we need to really start focusing more on prevention and making sure that that is becoming part of our conversation. For example, substance abuse prevention, for every dollar you put into it, you save $10 to $18 down the road. And so that's a huge cost savings that we could actually put into other things. In 2018, I heard a lot about public education. I heard a lot about public lands. Very, those are two very Montana things that you would hear about. And of course, we still hear about education, but now it has to deal with like COVID-19 and, just how, specifically like how are kids like going to learn, then the mental health aspect of it. And so you're really hearing more unemployment, how we're going to keep our economy. There's so many things. So we look at it as COVID-19 is right now, and it is a pandemic, but there's also going to be so many ripple effects after we get out of it. And you can hear that when you're talking to people, so that's really has taken over a lot of the conversations. I just call to check in, like, are you getting your groceries? Do you need anything? So I think after this gets over, you're going to see a huge, we're going to really see how healthcare, specifically mental health, is going to be affected. They've already sent me once. And I believe in, continuing to work for the House District 24 and all the constituents, no matter if they voted for me or not. I still am someone who's connected to the community. I worked hard to pass Medicaid expansion. I worked hard to help pass the presumptive firefighter bill. And I do believe that a lot. I've heard really great things when I'm calling constituents about my work in the legislature. And I just want to continue that work and make sure that all the people in House District 24 are represented. Plus, I am Native American, so I am Chippewa Cree, and I actually have a large constituent of urban Native in my district. And so they also see that that's reflected back at them.